Hello, my name is Dr. Daniel Appel, and I've had a number of questions recently from patients in regards to gingivitis. What is it? Do I have it? How do I treat it? So we're gonna go over a couple of those things to try and answer some of those questions. So of course, the first question is, what is gingivitis and how do I know if I have it? So go to the mirror, pull your lip back, upper and lower, and look at your gum tissue right around the teeth. If they are red, if they are inflamed, if they're swollen, if they're painful, if they bleed really easily to the touch, then you most likely have gingivitis or worse, which would be periodontitis. What causes gingivitis? Frankly, not cleaning the teeth correctly or frequently enough. Rotten food plus bacteria equals really angry gum tissue. So the next question is, what problems can be caused if gingivitis is not treated? So that really angry tissue response eventually leads to increased bone loss, which eventually can lead to the loss of your teeth as the foundation is eroded away. It's the early signs of a much bigger problem that we really want to jump on before it becomes the bigger problem. What are the treatment steps? So step one is at home, starting to become a rock star with your home care. That would mean flossing 2 to 3 times a day and doing it well, not just whipping through there and just making your gums bleed, but actually scrubbing the sides, each side of the tooth in between the teeth. Secondly would be brushing 2 to 3 times a day to get the bacteria and the plaque off. Thirdly would be adding some warm salt water rinses while we know we have a problem. Warm salt water rinses, 30 seconds in the morning, 30 seconds in the evening, swishing around the mouth and then spitting the warm salt water out. Warm salt water is magic to help any tissue irritation or cuts in the mouth or other areas that are bothersome. So initially we want to include this to help the tissues heal as quickly as possible. The second step, and an absolutely required step if we want to solve this long term, is to get in and see a hygienist who will do a professional cleaning. They'll evaluate what's going on. They'll give you coaching to make sure that you're doing the very best job at home with your home care. And then they will also clean away the hardened deposits that at this point are impossible for you to remove, even if you try. So how long does it take to treat gingivitis? With really good home care, with a professional cleaning from a hygienist, and then continued really good home care, we usually see pretty significant improvement within 7 to 10 days. And then minor healing beyond that. Primary concern with gingivitis is that it's a warning sign that worse things are coming. We want to deal with that problem and then get you back on track before we start to have much bigger problems. So if you need help, if you think you have gingivitis or worse, and you're in the Oroville area, please give us a call at Daniel Appel DDS. That is 530-533-7545. If you are not in the Oroville area and you are in need of a good dentist, I would strongly review going and looking at Google reviews. And you're specifically looking for the details in the reviews that show that the office culture is one that's very focused on comfortable care, very focused on good communication, and basically just focused on kindness with their patients. That goes a long ways. And that information about the office's culture is really to your benefit. Hope I've answered some of your questions. Have a great day.